Hey guys, today I want to talk about post-traumatic stress disorder, or PTSD, which is something you've heard a lot about in the media over the last 20 years because of the alarming rate of suicide amongst our military veterans. But the concept isn't a new one. Previous generations of soldiers also experienced similar symptoms, it was just called something different, like battle fatigue or shell shock, and there wasn't much of a medical response to treat these guys. But the rates and severity may also have been different, because at least this previous generation had a much longer period of transitioning back home to civilian life than our soldiers do today. This is simply because transportation on a ship across an ocean takes a much longer period of time than a plane ride home. So, in years past, these guys had the opportunity to talk to their buddies and process the horrific things that they had experienced overseas, compared to now, where people take a quick flight home and have no time to adjust back to civilian life after having been completely amped up in a military conflict. But despite this natural association in the media of PTSD with military experience, it's not just veterans or first responders like police officers and firefighters who get PTSD, and you don't have to have just one traumatic event that causes it. It can also be a series of traumatic events which accumulate over time that can produce similar symptoms. So, what is it? Well, your central nervous system essentially has two different operating statuses, which in medicine we refer to as the sympathetic and parasympathetic responses, but in plain language it's easier to understand by calling them fight or flight mode and rest and digest mode. So, when you're comfortable at home with your family, your brain is calm, your muscles are relaxed, and the blood in your body is centrally located in your GI system to process food. This is rest and digest. But what happens when you got to go outside to check out that strange noise that you just heard? Suddenly, your brain is more alert. The blood in your body rushes to your extremities to pump up your muscles, and you have no appetite. This is fight or flight. Both of these responses are necessary for our survival, but they need to be activated in the appropriate settings. So, if you're walking through the forest and encounter a large animal, or are confronting that intruder in your home, you wouldn't want rest and digest to be activated. Just like if you're trying to relax at home, or do a simple errand to the grocery store, or fall asleep at night, you wouldn't want fight or flight to be activated. PTSD is essentially when an event or a series of events rewires your brain so that fight or flight is activated when it shouldn't be. This is particularly problematic when it happens to kids, because then it really gets hardwired. You know, the outside world is a tough enough place as it is, but the home is the one place where kids are supposed to feel safe, calm, reassured, and loved. So, if there's neglect, or physical abuse, sexual abuse, or emotional abuse, then they're going to have fight or flight activated in that environment and never know what it's like to feel actually safe and calm. This can lead to a lifetime of being just generally mistrustful of people, and can also produce symptoms like anger, irritability, frustration, disrupted mood, and bad behavior. But trauma, of course, can also happen to adults. In the military, you can have a combat-related event that you just can't get out of your mind and causes nightmares and disruption in your mood, and you to be just generally irritable. But even if you didn't have just one traumatic thing happen in your military experience, just being on guard for a prolonged period of time, amped up in fight or flight, doesn't just go back to normal as soon as you get home back to your civilian life. Again, causing these symptoms of mood instability, anger, frustration, and poor sleep. But if you're not in the military, traumatic things can happen in regular life as well. You can be involved in a horrific car accident. You can have a child die. You can be sexually assaulted. And yeah, guys get sexually assaulted too, usually by other guys. You can witness a shooting, or a variety of other things that can also cause nightmares and the mood symptoms I talked about. In severe cases of PTSD, you can actually have flashbacks and act out on them. I'll never forget a patient I had during my first year of psychiatry residency at the VA hospital in Boston. This was a guy in his late 20s who had done 4 or 5 tours overseas in a short period of time and had seen a lot of combat. This guy was definitely a tough dude, assigned to a unit in the Army that did a lot of dirty work. But finally, he had done his time and was discharged home to his family. But things didn't go well for him pretty quickly back home in civilian life. He couldn't sleep next to his wife anymore because on a few occasions he woke up from a nightmare strangling her. He couldn't be around his kids really too much because he was so irritable and disconnected. And he couldn't go out in public because he perceived everything around him as a potential threat. The final straw was when he went missing one day and his wife finally found him next door, dug into a trench next to his neighbor's pond, in a flashback thinking that he was being attacked by an enemy. They couldn't get him out, had to call the police, and it took about 5 officers to forcibly extract him from that situation and get him into the hospital. Once there, he was admitted to the psychiatric unit and we began his treatment for PTSD. This, of course, is an extreme example, and flashbacks can happen to both military veterans and civilians. Fortunately, though, there are treatment options available, both with medications and therapy, but in order to make a full recovery, you'll often need both. With medications, we can treat the symptoms. We have medications that calm the central nervous system and can reduce nightmares. We also have medications for anxiety, if that's what you're experiencing, and we have medications for depression. There's a wide variety, but ultimately it's up to you and your psychiatrist to figure out what symptoms you're experiencing and which medication might be best to treat you while considering potential side effects. But while medications are helpful to treat the symptoms, they don't fix the underlying trauma and help the brain to accept and process what it's experienced to move beyond it. In fact, someone could be taking medications for years or decades and simply be covering up the symptoms which are never resolved. This is where therapy comes in, which many guys are reluctant to try, but you gotta understand that it's no different than that group of guys I described earlier coming home from World War II on a ship, talking to their buddies about the experiences they had overseas to help them process those horrific things. One type of therapy for trauma is cognitive processing therapy, which is a 12-step structured therapy designed to help a person relive and accept the traumatic experiences that they've had. Another one you may have heard of is EMDR, which stands for Eye Movement Desensitization and Reprocessing, which is designed to help a person relive the traumatic memories, but then realign those memories with more positive associations to reduce psychological distress. These are just 2 examples, but there are truly many other types of therapy out there that are effective for trauma. So whether you're a veteran or not, if you're experiencing these symptoms, know that you're not alone and there is treatment. You're not weak for having lingering issues related to trauma, but you will make yourself weaker over time if you don't get it treated properly.